We're here today with a brief media update. First of all, that the Public Health Department continues to work with the City of San Jose and other partners trying to identify individuals with Shigella, connect them to care, as well as to prevent other people from getting sick. We have identified since last week more cases. There are, as of this morning, 9 Shigella cases associated with this outbreak investigation, 6 of whom have been hospitalized, and an additional 21 suspected cases. We're working on 2 levels. First, working to educate partner organizations that serve individuals in these encampments, making sure they have the guidance they need to clean restrooms, protect themselves, make sure that if they're providing food, that it's prepared safely. We're working directly with the individuals in the homeless encampments, providing, when we're out there, clean water, hygiene kits, and making sure that they are educated about not using the river for bathing, drinking, cooking, or toileting. And lastly, we think that the risk to the public continues to be low. However, there are a few things that can keep everyone safe and healthy. That includes avoiding going in the Guadalupe River downstream of the 85 and Almaden Expressway. And we recommend that because we know that Shigella, only a little bit of the organism can cause infection. And we became aware that some of the sick individuals have been using the river for their own hygiene. And we want to, out of an abundance of caution, make sure that everyone knows to not go in the river, to not use it for drinking. It is a non-potable water source, and to keep themselves safe and healthy. I'm now open to answering any questions you might have.
Well, it's pretty obvious. People shouldn't fish there. Right?
So,
since the first report yet,
yeah, the biggest risk activity for humans to get Shigella infection is, being in the river themselves and swallowing contaminated river water. So that's kind of the thing that we are really wanting to make sure that individuals know not to do, and to wash their hands before they eat or touch their face. Those are kinds of the things that actually would lead to this infection, Shigella, being transmitted.
Are you at all working with the water agency to see if there's anything that can possibly do to the water?
Yeah, so that's a really great question. We are working with some partners that deal with the water, Valley Water Authority. Unfortunately, unlike swimming pools or closed bodies of water where there is very clear guidance on things you can do to remediate or protect, things like chlorination and things like that, when you have a body of water like a river, there's less data first on infection transmission in flowing bodies of water. And there's certainly not the same mechanisms to remediate that you might have in, say, a backyard pool. That's why we are focusing here at the Public Health Department on improving sanitation and hygiene, getting folks, preventing more infections, and getting those folks who are ill, making sure that they stay out of the river. So those are the best things that we can be doing to try to improve the water quality. Yeah, so again, testing for water is of limited value in this situation. If it's negative because we test in one area at one specific time, we can't necessarily trust that there's no Shigella in the water. So a negative test isn't helpful. A positive test could tell us that it's there, but we're already doing all the actions as if it is positive. And so it wouldn't change our recommendations or any of the things that we're doing in collaboration with the city and other partners, including partners that are working, on the water itself. Any other questions? Thank you.
we talk about Guadalupe River and Coyote Creek.
Yep. So we're talking specifically about the Guadalupe River. This is based on the fact that we've identified cases in homeless encampments, several encampments along the river, starting with encampments as far upstream or as far south as the area around the Valley Expressway and the Almaden Expressway. So once you go upstream of that area is where we have started, to identify cases. Now we have seen cases amongst persons experiencing homeless in other areas of the city that are not along a river source. At this time, we have not seen any on Coyote Creek. However, we are continuing to investigate that area as well.
What's kind of like the general consensus when we have the outreach team is out? How's that kind of perceived? Right along.
Yeah, my understanding is that, especially since now we've been out there for a couple weeks, that we are familiar faces in these encampments. People have recognized we're here to help, and they've been appreciative and expressed appreciation for the services that we're providing. Sometimes because as I've mentioned, we're bringing water, we're bringing hygiene kits, and I think a general appreciation that we're trying to do work to help protect them and their health. Anything else? All right.
Thank you very much.
Thank you.